Thanks so much for joining us. We have Diana, nurse gone rogue, with us. I just want to say you're not the only nurse that's gone rogue.
I
But
think that's
I'm
what we connect
interested,
on.
right? Yeah. I'm interested in your story though. I want to hear your gone rogue story. How did you go
Yeah.
rogue?
Well, what did you, my story is very big, but
I
what did
know
you
very
notice?
little.
Okay. Well, I became a nurse when I was 20, went straight into critical care, kept my job in the hospital and was like a house supervisor in Arkansas when I was like, by the time I was 24. So always like critical care background, did some NICU, stuff like that, and was in an abusive marriage that was kind of like primed for from just childhood, religion, family, culture. And I think, nursing, I'll never forget when I learned about, we were in psych and we were learning about borderline personality disorder and bipolar disorder and that. So I learned how to be a nurse and take care of patients with mental health, which I feel like kind of kept me in this loop of people need me, and, self abandonment, things like that. So my health was fine for the most part. I was in my 20s. I had 5 babies, so it was nothing like unusually crazy to me, even though it was very taxing on the body. Now, looking back, critical care, you go through so much trauma and you're seeing people die left and right or compensating, decompensating. So, anyway, at one point, I think the straw that really broke the camel's back for me with nursing, because I always kept a part time job, even when I built my very first business. Um, was when I was working for a very large hospital system in the Northwest, and I was pregnant with my fifth. I had 6 dependents on my insurance benefits, and I had my company at the time, my first startup. It was, thriving, but it wasn't crazy amazing yet. And I was just like, I like the security blanket. So I was about 6 months pregnant. Didn't they said it was for something different, did a formal discovery. I had never been in any kind of trouble, never had any kind of reprimandation at like the hospital, anything. And my understanding was that the manager simply did not want to accommodate me. I was very sick when I was pregnant, so like very low iron, PICC lines, like the works. And she pretty much didn't want to accommodate me or my schedule or probably FMLA afterwards. So they found something. They called it gross misconduct. It was my first time ever getting in trouble at a hospital, and they fired me on the spot. I lost not only my benefits as a pregnant woman, I lost all of my medical, dental, vision benefits, and everything that I'd worked for up until that point for my entire family. Um, so it was a very, very scary time, and luckily they were unionized, and I am a stubborn Taurus, so filed grievances. I got a few of the offers back, but it was definitely on like last chance type, look over your shoulder type of scenario, and I refused to take it. Fast forward, I leaned into my company. It exponentially grew. I exited that company, made my first million within like the next year following after that, after having my fifth baby. And I'll never forget when I got the call and they were saying they would like to settle finally because we were on the brink of arbitration. And I received like full make whole, with benefits, all of my vacation time. They back paid me for the amount that I hadn't worked for. And within the first week of me returning to work, the chief nursing officer that failed the grievances and mediation with me was walked off the premises. The manager that used to be mine was tucked back in the OR, so we would never interact. And later I found out left to a completely different hospital system. So it was a significant case, and I felt like very strongly that there needed to be some sort of a precedent set for other nurses that have businesses that still have their jobs, that it's not impeding their, workflow. It's not impeding how they're performing at work. They still have integrity. And, in that time when I was going through that discovery, they were asking me to basically be a whistleblower and saying, because I said, I'm not the only nurse that works here that has a business, obviously. And they said, well, who else does? Kind of trying to have me be the whistleblower. And I was like, I'm not doing that. I'm not going to let you target them too. And so I took the hit, but I definitely wanted to set a precedent to make sure that they would think twice before ever firing a nurse that either has her own company outside of the hospital system. That's not a direct, obviously conflict. It's not a conflict of interest. And also pregnant women. I mean, a lot of us keep the benefits because you just never know what could go wrong. You have children, you're yourself pregnant. There could be so many possibilities of things that go wrong. So we did set a precedent, even though we didn't go all the way to arbitration, and I was made whole. So that's when I really kind of like went rogue. Like I was just like, there's no way that I'm ever going to put my livelihood in the hands of corporate again.
Absolutely. Yeah, I relate with that so much.
Mm-hmm.
I preach about it on my channel too. It's like I got fired for having a seizure after I was assaulted by a patient, and that doesn't make sense. It's like I'm still in the middle of legal stuff, but it's just absolutely horrifying. It's the craziest feeling. It's undescribable.
Yeah, I think it's probably more than anything, it's very emotionally triggering for us because, I mean, anybody that I know that's gotten into nursing gets into nursing because we want to help people, right? And we go at it, you have to go at it without any judgment because you get you get homeless people, you get rich people, it doesn't matter, you know. Illness does not have prejudice against who you are or what walk of life you came from. So it's just really difficult to see that we are treated as just numbers in many ways, that we are treated as inconveniences. And then, we don't have a contingency plan. I know so many nurses that are brilliant, have 30, 40 years of nursing experience, have their master's degrees, some of them their PhDs, and or DNP, and they're too scared to venture outside of a structured system without really knowing that really nursing was always a private healthcare system. It was before it ever became something that corporate kind of hijacked and has taken ownership of. Like they're basically very expensive landlords at this point that have people working for them. It's an in slavery to the systems. So yeah, that was big and eye opening. I'm here on a mission to help other nurses transition outside of corporate healthcare. There's no shade to it. Some days I do miss the camaraderie. There's something about being with a group of people when shit hits the fan or not, coming together, feeling relief that you have people that have your back, this team feeling. But at the same time, because everyone is so kind of stuck and constrained in that lifestyle of paycheck to paycheck, work this much, get this much, and not really diversifying financially or having true financial freedom, if you get fired, no one's coming to the rescue too, right? So the camaraderie only goes so deep and so much. So I prefer, creating my own teams and things that people are not necessarily going to fire me from. Different scenario, but still, nurses have been taught how to be business owners. We just haven't been taught the language.
I agree, and that's something I had to learn after I was fired. I was like, I have to figure this out because I still want to use my knowledge and what I learned, but I don't want to work in this system anymore. I don't want to be abused. I don't want to be assaulted and have a seizure. I don't want to be unhealthy. Everyone around me was so unhealthy, and I was so unaware of that culture. It was just consistent everywhere I went. I traveled, that ER was the same. It's definitely a culture, and it's difficult.
So, what are the some of the things that you wish you would have known as a new nurse? I'm approaching 20 years. I don't know how long you've been a nurse for.
I've been a nurse for 6, so a little less than you, but um, I would say I wish I had more reality. I wish it wasn't it for me, it was saving lives. That's what I thought I was going to be doing. Just I'm working in the ER. Everyone's going to come here. They need saving. It's going to be an emergency. And when I got my tech, I was an ER tech while I was in nursing school. I started realizing, okay, there's some emergencies, but a lot of these nurses seem like upset. Everything seems to be an inconvenience. Nobody's really getting better. They know all the patients. They predict who's going to come in. Everyone, it's not like how they describe it, like, oh, you're just an adrenaline junkie. You love the adrenaline. Like, no, it's more constant stress, constant nervous system breakdown. It's very different from what they couch it to be. And I wish there was more honesty, realism, what it is, what the business is. This is our business. You're here to help run our business. And I wish there was more nutrition involved in nursing education. I think that's huge, and I think it's missing, and I think that's overruled. I knew so much about medications. I knew zero nutrition.
Yeah, I agree. How do you feel about the policies that they've just started dropping with regard to hospital food and the requirements that they're now making them abide by?
I'm excited. I'm all for it. I don't know if hospitals will follow through. I have no idea. And I'm not in the hospitals anymore. Are you still working bedside?
No, I have not worked bedside in about a decade.
Okay.
Mm-hmm.
Nice.
Right.
Yeah, so I'm curious to see if hospitals follow through. I mean, obviously they want their money and their kickbacks, so hopefully that'll encourage them. But there's so much more needed than just feeding people the food. It's like we need better education for the patients, the public in general, public health education.
We exactly. It's all about preventative care, and honestly, we don't have that. That system is, and I don't think it's necessarily just a nationwide thing. It also is very much a global thing, right? Because if it's big money everywhere. A little bit less in some areas based on structure, but it's still just a broken system overall because it's made for the masses. So now what we're seeing more and more is this concierge medicine, the privatized healthcare that's really going to explode. I actually was talking to over lunch about some business meetings I had yesterday. One of them was with Connect MD, which is a telehealth platform that is exploding. I think they're about 6 years old, and they are you familiar with them at all? So they will allow you to become a member. It's basically concierge medicine, telehealth, all 50 states covered. You can add up to 7 household members to the same plan. Mental health is included in your price, so it's like free. And then they have about 1,000 different prescription medications that are free also to their members. So they can be prescribed to them because those are like the highest frequency of prescribed medications. So I was talking to them about opening up or launching an advice nurse part or something. So they just, one of the owners, one of the doctors went and spoke in Congress and said he got a lot of pushback because, of course, this is going to threaten big pharma and the big box insurance companies. Because if we can be this lean and effective and efficient with this lean of a team, imagine what we could do if we could focus as an entire government, as an entire country. So, but said that, after that Congress meeting, we got called, I think, I want to say to like Baltimore, Maryland or something, had one of the mayors sign up 62,000 constituents to their plan. So it's definitely gaining a lot of momentum. I've seen in the past maybe 7 years since I've gotten back out into the business community, a lot of self-funded healthcare with bigger corporations. I don't know if you're familiar with that or not. So instead of companies paying for these big boxes like Blue Cross Blue Shield, Kaiser, with their, high premiums, their shitty deductibles, and things that are just like non-covered, what companies will do is they'll take consultants in that are self-funded insurance experts. They will carve out a piece of their budget. They will forecast. They'll do some sort of research on what their costs are like already. And they will get their whole company set up with their own curated and pre-negotiated physicians. So, for example, if Leroy has to have, hand surgery, this Leroy would go from Washington to Idaho to a very renowned hand surgeon that already has a contract. But the surgery, the travel, the recovery time is all going to be way less expensive than if they were to stay in, with an HMO or PPO, whatever their plan is, in the same city and do the surgery in a major hospital. It would be still like a fraction of the cost. So there are a lot of companies that are doing that because they can also roll over their money into the next year's fund. So that's where they're focusing more on preventative care. They're focusing on employee assistance programs so people have access to all the different specialties, mental health specialties. I had someone call and look for a place for their old elderly mother that had dementia, found us on their company's employee assistance program suite of services. So I have my bread and butter business is boutique nursing homes. So I have 2 facilities in Camas, Washington, and we take care. It's basically, you drive up to it. It looks like a normal house, but it's ADA compliant, handicap accessible. It's a state licensed facility. I have caregivers there 24 hours, and loved ones, family members will place their loved ones with us to receive professional care so that we can allow them to just be family, especially when you think of hospice, making memories, making that be more of your dynamic versus take mom to the bathroom, brush her teeth, do this, clean. The caregiver burnout is so profound that they don't get that quality time. So smaller facilities, very individualized care plans, very tight resident to caregiver ratios. And, it is a wonderful business model for, I wish more nurses owned them. That's my next, journey, is to launch my consulting program for other nurses that would like to diversify their income, build generational wealth, their own real estate portfolio. This is really something that our society is needing. We all know the baby boomers are coming. I call it the silver tsunami. We have so many homes and assisted living facilities and nursing homes and big box shops that are owned, by people that know nothing about patient care.
And
Absolutely nothing.
It
And
shows when you go in them.
Absolutely. It's devastating. It's devastating for a family to have to choose an assisted living facility or a nursing home that is a caregiver to resident ratio of, at best, 1 to 20, and at worst can be 40 up to 60 at some point. You have one nurse passing medications to 150 different residents. Like, are they really getting the medications? Are they, like, physically, how many times can you touch a human being in an 8-hour or even a 16-hour shift if you have that heavy of a census and your census is mixed and you have people that need a lot more care and attention versus the people that don't. Who's going to get neglected? The stronger ones, right?
Yeah. Wow,
So
that's incredible. We really do need more homes like that. Wow.
we
I
have
want to
there.
know more.
There are so many of them. The biggest challenge that's been is, as nurses, we've been taught to work within a system, work with SOPs and certain guidelines, wait for a paycheck. You know, trading time for money is what we were taught as nurses, hands down. But we were also taught how to measure things a certain way. And I think because we were never taught how to do business and how to manage, like how to externalize our care and outsource it, it's so scary for us to think about it. And because we come to it from a place of burnout and exhaustion, typically, you've been working for however many years in a hospital, in a nursing home, in a clinic. You're always tapped out, you're burnt out. When you're off, you just want to be off. And so this whole, it becomes a snowball mentality of like, I can't ever imagine having to be responsible for someone 24/7. Well, if we had the blueprint and had been taught how to have an actual work-life balance and how to structure things, it doesn't have to take over your entire life. It doesn't have to be a 24/7 type of scenario, but you have to understand infrastructure and architecture of HR and of how you build people, how you promote people within the company, how to reinvest in your company. So that's something that I'm really passionate about doing and teaching nurses how to do, because really I've known too many nurses that get fired, they're close to retirement and getting their pension. How many stories have we all heard where they get fired, 3 months before they were supposed to retire and get their benefits?
Yeah.
They get a really shitty severance package, and then all of a sudden, you don't even have the retirement that you've been working for 20 years. But if you build your own company, that is your retirement. And if you build one with the real estate as well, you're building a portfolio. Any millionaires that you know probably started out with real estate. So there's just a lot there of just like the lack of knowledge, but really a lot of these elderly homes are run by people that are English as their second language. They have zero clue of even how to be a caregiver. They may have had kids, come from a big family, or a culture that just so happens to be more community oriented. So they will go and they will run at it and they will become wildly successful. But then we have these overqualified nurses and even like CNAs. You don't have to be a nurse to own one. You can be a CNA. But these highly experienced individuals that are stuck trading time for money versus really leveraging their knowledge and educating other people how to take care of people. And, I know it's scary, but there is a recipe. There are ingredients, there's a recipe, there's a whole formula you can follow, and you can just rinse and repeat once you get that experience. It just, you have to like take that first step and sometimes that step is taken away from you, like in your scenario.
Yeah. Yeah, that step was taken from me. But it was still really scary because I'm still figuring it out. It's just a process I'm still learning about business. I'm still learning how to structure everything and what I want to do. But that's the blessing of it all. You can choose what you want to use your license for. You can work for the system and feel the way you do and not have the money you want for your family and for your future, or you can be uncomfortable and do the work that you already kind of did through school. You worked really hard to get through nursing school. That shit is not easy.
Exactly. One of my most viral clips is actually a clip of me talking on a podcast and saying that nursing school is, I would say, harder than boot camp.
I think I saw that one. Yeah.
It's a lot of controversy, but I've been super impressed. I want to like re-edit it and add some of the comments to it, but I've had a lot of people that have done both and they agree, because they say that in boot camp, at least there's an end goal to it. And you have people that want you to succeed and you're exerting yourself physically, right? You know that it's a 60, 90 day thing. Like there's an end date that's clearly in sight. and you have these goals. In nursing school, it's kind of like this rumination, and like you're stuck in this like mental exhaustion of second guessing yourself and self betrayal and selflessness. And you're studying as well, and you're this and you're that, and you get kind of different personalities from different instructors too. Like, at least like in the military boot camp, like, what to expect. You're going to have a lot of people telling you to go fuck yourself. You're going to have people telling you you're a disgrace. You're going to you've kind of like braced for that before you signed up for it. But in nursing school, you didn't know that someone could send you home and you lose a clinical day because you forgot your name tag in your car.
Or your stethoscope or something.
Or your pen. Yeah. Right. Like it's that seriously, mentally exhausting and just like scary. It's very traumatizing. And I thought maybe, I went through a hard patch myself, but then I watched one of my sister-in-laws went through the same exact program I went through. My brother went through a different program, took a much like slower route, became a CNA, LPN, then RN. And then two of my sisters went through the same exact program that I went through as well. And it was just like, it was traumatizing for every one of them. There was always conversation around, this instructor is just that way, and this is what you got to do. And like, why are we having to, bend ourselves to personalities because like you don't know what you're going to get? It's like, it really is like this mentally draining, traumatizing thing that kind of primes you for nurses eating their young for the hospital setting, right? So we're not taught how to collaborate. We're taught to compete. And for what? Because the raises that they gave us in the hospital were at best, 2% a year?
Oh, like cents. I think I got like 37 cents raise one time.
Per hour.
Keep your change.
Right.
Keep your change.
Because when you're in what I do know about business is, and this is why I have a nonprofit as well. But what I do know about business is that, what you put into it, your return of investment, 100% of it comes back to you. And sometimes your return on investment can be 300% of your 100% in a very small amount of time. So if you apply your work ethic that you're doing for a mega corporation that you're just a number for into your own business, but you do it in a way that is strategic, planned, you surround yourself with people that will teach you how to do it effectively and efficiently, there is nowhere to go but success. Right? I've talked to attorneys. The amount of successful people that are in my circle now. Sitting at a social networking event last night that I go to every week, and I go just to socialize. And I'm sitting there and listening to mind-blowing conversations about AI and how we can use it and what happens in these acronyms. And I'm just like, how grateful can I be that I don't have to worry about, I need to be up at 6 a.m. tomorrow, and do this, and it's the grind, same shit, different day, but you see all of these people, and the majority of them, some of them have finished school, college, some of them have not. Most of every one of them that I've ever talked about education with has said, and I quote, I wish I would have never paid for school. I wish I would have spent that money on coaches. Because they're going to extrapolate everything that you should have learned, and maybe have learned or not have learned, because it depends on what professors you get. And they're going to teach you how to integrate and implement it very fast. So that's the secret. So when you are looking at someone that can teach you something that's like a business in a box, that's going to charge, tens of thousands of dollars, but if you compare it to, because we've had now this like whole political conversation on like, is nursing a professional degree to where, student loans cover our master's degree, which by the way, we were paying back anyway, right? This is like a $150,000 to $200,000 investment in a degree that you will repay back with interest, mind you, and still not know how to start your own business, still not know how to be financially free, still basically priming you to go work underneath different practitioners within a system, within like the confines or whatever. You think you're going to be happier because you're going to have some autonomy. Really, it's just a joke. Like, you don't have your autonomy. Just kidding. I'm not saying that nurses should not become nurse practitioners. I love that idea. I've toyed with it so many times myself. But what I am saying is, if you find a program or someone that is willing to teach you everything and has a proven track record and is willing to teach you everything you need to know about success in healthcare, if you're a nurse and you're passionate about staying within the healthcare field, which I have never regretted my nursing degree, but probably because I've experienced so much success utilizing it, right? And I do know people that have like regret or just don't really, it wasn't it's failed to meet expectations. It's disappointed them.
Yes.
But if you can find someone that has a proven track record and is committed to your success, why would you not invest in, a program like that versus investing in a degree that you may make more money, you also may not. Like I said, I knew plenty of nurse practitioners that were still working as night shift charge nurses in the CVICU because the benefits were just too good to leave, right? It's that comfort. So if you're not uncomfortable within your career and within like your growth, where you're growing or where you're going, then you're not growing. If you're not uncomfortable, like discomfort is a very, very clear feeling of, and the result is growth. You can't be uncomfortable and not grow out of it.
Yes, very true.
That's the thing.
Yeah, yeah. And that's something that I struggled with, but I'm so glad that I meet people like you who truly inspire. Like, I was totally in that mindset of, what am I going to do? I'm a nurse for the system. I have to go back to the system. And it's just a daunting feeling. But to know that there's other things out there is just incredible. And it's relieving. Like, you can make more money than you are at the bedside.
I was working part-time at the hospital and I had my company, which I already knew what my goal was. I knew what reimbursement rates were. I knew where I was headed and I knew what it was already doing, even in the beginning phases, right? And I'm sitting there in an OR with an anesthesiologist and we're talking about making money, business, this, that, the other, right? I'm a networker at that point, right? And we're talking about how much money a month he makes. And then I'm sitting there thinking, like, in my head, I'm like, dude, I'm gonna make as much money as you make in a year, probably within like 2.5 months. Like, I will gross that much. It's an insane ability to make money as nurses. We are so underutilized in this society. And it's not, let's not even talk about like group homes, right? Because some people are like, ew, my worst nightmare was taking care of tracheostomy patients, right? And that wound up being my first group home though. I took care of long-term ventilator clients and it was a really wonderful reimbursement rate from the state. So it's a thing, it's a real thing, but you're doing it anyway for $40 an hour maybe. In some states, $75 an hour. So what if you could do it for $23,000 a month for one client?
Wow. So what were you doing while you were working part-time? Like, what did you start doing? Just
I
your
I
own?
I found the most piece of shit house in a piece of shit neighborhood because I still had bankruptcy on my record from back when the economy crashed in 2018. We bought the house seller finance from an old man that had a pretty big portfolio of homes, renovated it. I was married at the time, so my ex-husband did more of the renovation side. I was all licensing and business startup. Got it licensed by the state. It's called adult family homes in Washington state, adult foster homes in Oregon state. So every state has a different type of program. I was laughing with someone yesterday and was like, you could probably drop me off anywhere in the United States and give me any house and I could get it licensed, right? Because it's a system. It's just everybody has their quirks and kinks and their ways of doing it. But long story short, I challenged an existing contract, got that contract opened up for the entire state of Washington State. It's called private duty nursing. And yes, private duty nursing. It's basically skilled nursing for patients out in the community. A lot of them live at home. And it just gets very costly for the state because you're sending one nurse to one resident, right? So they came up with an idea and they said, what if we have our licensed, small assisted living facilities or adult family homes that are licensed up to 6 beds? What if we just give them a contract if it's a nurse-owned home and they manage 6 ventilator clients in one home? It's still going to be way less expensive than having them in a nursing home or having them in a long-term acute care hospital or LTAC, or certainly more cost-effective than having them in a critical care unit, right? So it's a fraction of the cost, but it's astronomically well compensated in a private setting where you really can staff almost critical care level, matrix. So you have a 1-to-3 resident ratio at worst. You could upstaff because you've got enough of a bottom line and profitability to be able to do that. So how many nurses did I know that we would sit in the nutrition room just chatting it up on night shift, and they're there picking up extra shifts because they want to save up for a boat that their family wants to buy, or they want to buy another house, or they want to renovate their house, or whatever, which tells me, and I know this, nurses have the capacity to make the money to invest in a business. It's like we just don't know of the business to invest in. We don't have a clear direction, and we were never taught that. We were taught to work within the hospital, to grow within the hospital, go back to school and come back to the hospital for a higher, elevated position or whatever. It's the same shit, different day. It's not, you make more money, you're going to spend more money. That's how the system is made. Unless you make enough FU money to where now you're like, okay, how do I spend my money so that it makes me more money, so that I have the freedom to chase my passions and dreams the right way, right? And that's right. That's what it should be.
Totally. Yeah. Oh my gosh. I'm so happy we connected.
Yeah, absolutely.
For real.
So, and I have, because what? I'm sorry, I
Oh
interrupted
no,
you.
no, you're good. I'm just saying because it's difficult. It's difficult to come out of that mindset of you work for the system. It's truly like being enslaved or in jail.
That was my other viral clip. Did you see that one? I got a lot of
No.
shit about that one.
Oh man.
Yeah, when you're a nurse, you literally feel like you're a slave. I mean, that's how. I'm not comparing, and I've spoken to. I have plenty of black friends, and what it's not meant to be at all comparable or condescending it's supposed to be illustrative, like it's a feeling, right? Yes, you're getting compensated and whatnot, but she said no, it's true. It's a trap. It's a trap. You feel trapped is what like maybe a even better scenario is, but you can't leave your assignment if something happens while you're on your shift, because that's considered abandonment. You can lose your livelihood. You can be locked up. It's considered abuse, right? So like, okay, like we're getting somewhere there where we're talking about it. But I just feel like, yes, not enough nurses are, and even physicians. I've spoken to so many doctors, and wonderful doctors, absolutely terrible at business. They don't know one thing from the next, but they get money thrown at them by the corporate healthcare system because it just makes sense, right? They carry a very heavy load, census load. Their billable hours are much more. What they say goes, like they're the top of the hierarchy. So they have they hold more value for corporate than the nurses. Nurses are a dime a dozen in corporate healthcare, even though we are the heartbeat of, the healthcare system. Us and ancillary, right? We are the heartbeat. But I think if more nurses understood very concretely how, did you learn ADPI, the nursing process?
Yeah.
Assessment, diagnosis,
I
planning,
forgot about
implementation,
that.
evaluation.
How do you remember that?
I don't know. I have a freaky memory. But it transfers. Those skills transfer. They transfer
Yeah.
to business. It's just a different language. And no one is sitting there connecting the dots for us. And you go back and you reevaluate. And yeah, you're going to have some failures and fuck ups and whatever. I have so many stories I could tell. And, but the best story I have is I bet on myself as a nurse. I'm a great fucking nurse. I provide great care and I can teach people how to provide great care. Why do we not have more nurses doing that? And it doesn't have to be group homes. You can be a legal nurse consultant. You can be a concierge nurse. You can be an advice nurse. You can be a chief nursing officer for a venture capital fund. You can be, there's so many opportunities and options. You can have a durable medical equipment store. You don't have to limit yourself. Why are all of these non-medical people making hand over fist and money and they don't even know what a nebulizer is? Like, talk about DME. What's a nebulizer in comparison to what's a good a cough assist, whatever.
Yeah.
They don't know what that is.
Anything. Yeah.
They don't know what that is. And we have such a capacity to make an impact. And I know that's it's been so painful seeing the nursing industry fall even more apart after the pandemic. It just wrung out all of our new nurses around your your tenure.
I graduated 2020. So I graduated February 2020, started my job March, and was in the ringer from the beginning. And
Yeah.
it was just so much, first of all, BS and just so much work and fear and trauma, like you say, and I felt like I was trapped. It was a trap
Yeah.
completely. And I'm sure many nurses that graduated 2020 and beyond have felt very similar.
That every nurse that I've spoken to that is around that tenure or less, and even a little bit more, just because of the experiences they've been having, have been like, I hate being a nurse. And that breaks my heart, absolutely breaks my heart, because I was fortunate enough to catch the previous generation of nurses. It was still paper charting. I graduated in Arkansas, so we had all of the old people, all the comorbidities, all of the uneducated. You got to learn a lot, and it was shitty work conditions and things like that. But it really did give me a deep appreciation for when I did go to, I moved to Washington State and Oregon State. I was like, wow, this exists. And then I left and I created my own company where I could treat my employees the way I would have liked to have been treated. And I was like, wow, what do you mean? This is possible? You're telling me we can create workplaces where people enjoy coming to work and don't have a big ball of anxiety in their stomach when they come to work? You're telling me we can have, company Christmas parties and this and that. Yeah, there are some trade-offs. We don't have maybe the best benefits because we're still working on that. But hey, we have people that care, that are creating products so that we can offer some benefits. And what's a better benefit? For you, for example, if you were, a business owner and you had a team, right? Which is similar in my scenario. I'm very passionate about body optimization, biochemistry. I do that stuff on the side as just fun. And I've had some really great success stories because of my background in critical care. But how amazing would it be for you to have a team of maybe 5 employees that you get to work in close, proximity with? You're teaching them not only the skill to be successful in life, but also, they may come to work and or call out sick and be like, "Oh my gosh, I feel terrible. This is what's happening, da 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 da." And you help them problem solve and they learn how to use food as medicine. Do you get what I'm saying? Or like me having someone that is, because I have a 501c3, it's called the Blind Investment, it's a nonprofit for domestic violence, transitional housing, and entry level employment. So we can take someone from, abuse through business ownership within pretty much a 5 year plan. But at one point I had 80% were domestic violence survivors that were working. How amazing is it for me to be a survivor, right? And to know how I need to communicate with these women mostly in a way that is not going to make them feel triggered, in a way that's not going to make them feel low self-worth, in a way that's going to make them feel empowered, like they do have something, or if if the trauma is manifesting in their body, talking to them about what kind of supplementation do you need, what kind of lifestyle do you need, to be able to support your body, because as you're going through this transition, now your body is bringing up all of these things that you've suppressed. And now that we're learning more and more about trauma, how it lives in the body, and how it comes up and it manifests as autoimmune diseases and things like that, now you're able to, what better of a benefit can those employees get than having a one-on-one coach that knows firsthand how to heal the body from the inside out? Because they're not going to get that from any other benefits package in these large big box hospitals. They're just not, let's be real.
And that's an amazing thing to think about is there's a huge opportunity for nurses right now. Even if like they left the bedside already and are doing something else, there is a huge opportunity that people are seeking outside the normal medical system. They don't trust the system anymore. They want to trust people, but they've kind of turned their head and they need people that want to reach out and say, hey, food's medicine, and say, hey, you can build a business and you can be successful on your own.
Right.
It's needed and it's a huge market right now.
It's a false sense of security that we are getting from our jobs. I was literally messaging with another nurse that has a great following. And, she had made like a funny video that was pretty much like, me like picking up extra shifts for my job that I really don't have to work, but maybe like 2 shifts a month, and still feeling like I'm not financially free, but really thinking like, like
Yeah.
we're in this thing like where we've gained some traction, we've learned how to be. I did it the other way around, and not necessarily by choice, and there's no wrong way to do it necessarily, right? But a lot of people are super influential on social media, but then they've never really been taught how to monetize their presence or how to have a backbone of a business that really sustains that lifestyle so that you can chase your passion effectively and have, that grounded, everybody wants the security, right? But it's a false security blanket when you're like, well, if I go there, it's just like any other addiction. If I go to work, I get this money. Bing, bing, like bang, bang, bop. Like I know that much, nurse math. If I do this many overtime hours and I exempt my taxes, whatever, I'll pay them later, then I have this much and then I can probably do this. Well, what if we were to change that mindset and mentality and say, if I invest these many hours or this much time in this business, or what if I just go like a batshit crazy person towards this goal for the next 30 or 60 days, what could happen? And I'm telling you, more often than not, your life will improve, your income will improve, it will come to you, because the universe needs more nurturing bosses than it needs narcissistic bosses. And we have too many of the latter and not enough of the prior.
Oh my gosh, I couldn't agree more.
Yeah.
Thank you so much.
Yeah,
Oh my
absolutely.
gosh.
Yeah.
If one of my audience members wants to find you or reach out to you, do you want them to go through your Instagram or do you have?
I prefer that they go through Instagram. I'm still very much in control of it. It has grown and grown, which I'm very proud of. But it's been like a year of feeding the meter. So now that I have the nurses' attentions, I would really, really love to consult. It doesn't matter what type of business you want to do. I have about 20 years of experience in business, 10 years specifically of not collecting a paycheck unless I've signed it for myself, building countless lives, helping countless lives. So reach out via Instagram, follow me at Nurse Gone Rogue. I am working on an event specifically for nurses that would like to transition outside of corporate healthcare successfully. And much like any domestic violence or abusive relationship, it may take you a couple of trial and errors and failures. The typical victim tries to leave and fails approximately 7 times before leaving successfully an abusive relationship. So we collectively are being abused by the system. Okay, some more than others, and we need to take the reins back. There needs to be more nurses that own home health agencies, hospice agencies. We should not be in the positions where we are taking orders from people that are not medical, that don't know what the fuck they're doing, and don't know what kind of compassionate care we're gonna be able to deliver to not only the patients but their family members. I can't tell you how many. So look me up. I'm in St. Petersburg, Florida. If you are ever here and you want a free session, come buy me lunch in downtown St. Pete. I've got a few restaurants I love. But otherwise, I will be building out an event. I'll start probably smaller for the first one, and then we'll continue to grow. I want to cover, marketing yourself, content creation, do a lot of collaborative things, basic business strategy, like the very 1, 2, 3 nitty gritties. And then there are obviously more extensive packages where someone just wants to build their own business in a box and really build their portfolio and their future of financial freedom. I'm a single mom of 5. It's been 7 years since I left my marriage. I started over with 3 suitcases, rebuilt to a portfolio of around $3 million in under 3 years, starting with nothing. So you are your only limit. And if I could do it, I promise you everybody can. It just takes a decision.
So true. You're inspiring me.
All right, good.
Thank you so
I'm excited to
much.
learn more from you. You're
I
welcome.
know. All
All right.
right. And if you guys enjoyed this episode, share it with a friend. Go follow Diana, Nurse Gone Rogue, and we'll see you guys next time.